My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware, diet, and environments. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thanks for coming back to this edition of the Heavily Meddled Podcast. I am super stoked to have my friend and mentor, Dr. Kim Duramo, joining us from the beautiful golden, at this time of year, Colorado. I am so jealous. I just got back, but I'm still jealous because you get to live in it and I don't.
Great to be on today and get to connect with your community. Thank you for having me.
Yeah, so I'm going to just kind of tell everybody why you're here. This is a little bit of a departure for the Heavily Meddled Podcast. Usually we have doctors and surgeons, and Dr. Kim is an actual doctor, so she's a DO, and that's great. But we usually focus on metal allergies. Today, our focus is still metal allergy, but we're bringing in outside help for dealing with the PTSD from our metal allergy. And that is an area that many of us are still stuck somewhere in the process of diagnosing what exactly our allergies are, getting our doctors to believe us, having hardware removed, trying to figure out a new diet and a new way of life. And there is so much PTSD that comes with just being gaslit and not heard on this journey. And our mental health is often ignored. And Dr. Kim has long been a mentor of mine. I follow her programs. I'm just going to let her tell you about herself. She has her own journey with chronic pain and worked in allopathic medicine for a long time. And I'm just going to let her bring the beauty and the gift that is her to you guys. And I'm super excited. So tell us a little bit about you, Dr. Kim. Give us your background and your story before we move on to the healing part.
I have been very empathic and sensitive since I was really young, could feel people's energy and feel their emotion and hear the thoughts and really have that more expansive perspective. And then sort of knew I was here to go into medicine to bring that greater depth of our interconnectedness, of the truth that the mind and body are connected and that our thoughts are impactful and have a physical expression into the realm of medicine so that we could begin to practice more consciously. And so I became an ER doctor. I worked in trauma and critical care, but always had the awareness that I was here to ultimately create a practice in mind-body medicine and help people with self-healing. And so, along the journey, had my own healing crisis, I guess, and developed a really severe autoimmune disease. And I'd understood about the mind-body connection, but I didn't know how to apply that. I just knew how to try to overcome it and not let it get me down. And that just made me sicker and sicker because, if you're fighting against something, you're in that inflammatory state and you're creating, with autoimmune, your body is gearing up against itself. So I had to really learn firsthand by listening more deeply to my body and let my body show me what mind-body medicine really is versus everything I'd read in a book or everything I'd thought about it from the I've got to fight it, I've got to overcome it perspective. And that took a lot of surrender to really listen to what is my body showing me. It took a lot of trust to really let that in and let it guide me through something that, it felt scary. If you stop fighting the fatigue, would I just be nothing? Would I just blob out on the couch and not get my energy back? And what my body showed me was that really wasn't true at all, that I could
And
surrender.
You had chronic pain, and you also were told that this was a forever thing that you would always have, right?
Told I'd have this disease forever. I wouldn't be able to run again. I would have to completely alter my lifestyle and control my environment. So it was really upsetting and not compatible with what I was intending to do in life. So yeah, that all resolved once I really practiced surrender, true surrender to my fear, to the pain, to everything I believed, and really just let go to let the truth guide me. And my body healed within a very short time.
Pretty miraculous. I think I remember you saying it was like super short, but it took years to get to the point where it became super short.
Yeah.
I'm going to backtrack just a little bit. As an allopathically trained physician, what do you know about systemic metal allergies? What experience have you had in that realm?
Well, the body can react against anything. I mean, it can even react against our own cells. And when we're in that inflammatory state, it's like a hyper reactive state that the body's going to react against a lot more. I had all these allergies and my body was reacting against like 20 different things that it hadn't previously reacted against. I didn't used to have that allergic autoimmune thing. And so my question I began to ask wasn't, how do I overcome this? What do I do? It was, how do I let my body go back into that non-reactive state, which is a state of peace and harmony? And so for metal reacting against metal, there's programming in there because, it could just be incorporated. We could integrate, okay, there's this metal. Maybe there's a way it could even be helpful and the body could receive it. Just like someone gets a kidney transplant and the body's trying to reject that kidney. But there are ways we can help the body receive it. I have a great example of this. Our nanny has a kidney replacement and was on a ton of different medicines to prevent rejection. And a lot of them were making her very sick. And we did some healing treatments to help her body integrate that organ to a higher degree. She didn't completely get off the anti-rejection medications, but she was able to shift so much that the body integrated even just a little bit more, that organ into her system. It received it. It allowed it to be there. There was harmony and her health came back. She had energy. She stopped having all the reactions she had been having. And so just like with metal or hardware, I would look into, and I've worked with individuals specifically with this, all of those fears of the system, the doctor, the hardware are on a deep level. Like, this is foreign, this is harmful, this is bad. And it isn't that, I'm not saying, oh, your doctors are only good, you should blindly trust them and let this all in. That's not what we're saying. I'm saying that the overreactivity in the system is not actually protective. So yes, there is something valuable about not blindly trusting the system, right? But let me receive what is here for me. Let me receive what can be helpful for me, and not needing that extra padding of reactivity and guarding and protection. And I'm not going to let this in, because then the body is literally rejecting everything that's trying to help.
Well, and you're not saying, and we're going to get deeper into this as we go, but you're not saying that it's all in your head and your head can control everything and all the outcomes. Sometimes, like in my case, medical intervention was required. Maybe I'm just not in the place, but I'd love your opinion. I likely could have done all the Mindbody tools in the world, but I had something that needed to be medically addressed and medically handled. And that's not a bad thing, but it's to go into that without fight or flight and to receive that with ease and grace and be grounded in the moment and in the space to be able to receive it. Am I saying that right?
You are. And when people tend to think of mind-body healing and they think it means we don't need a physical thing, that we're just way off. When we're actually in a mind-body receptivity, there'll be more physical things. There'll be more medicine or a homeopath or assistance or a person who does healing or something that can come in to be the answer and be a solution. It's not for everybody. Sometimes people will just heal. And I've seen many people get off all of their pain medications and get off all of their anti-anxiety and depression medications very often. But you will find on some level more resources come in, not less, whether it's in the form of loving friendships or like a pet, or sometimes there are medicines or practitioners, but they're functioning in a different way that can bring other resources. So it doesn't mean, oh, I've healed and come into this wholeness, and so therefore I don't need any physical things. That's not at all what we're saying. Sometimes we come into
bring on the gluten, bring on the nickel in the diet. Let's eat it all. Let's do all the bad things.
Yeah. Well, and they're not even bad things. Like if the body has resilience, it can clear those things and actually let them be medicine.
Yes. And I think there's got to be something to the fact that so many patients have to see doctors and doctors and doctors, and they feel dismissed and gaslit by their doctors. But if you were in a space where you can be more grounded, less reactive, in less fight or flight, then you probably have not only the energy to put forth and be better received by the medical professionals, but you probably have then the discernment to say, this is a fit for me, or this is not a fit for me. I need to move on, and it's okay.
100%. It's about getting your power back. And in one of the programs I have, it's called the Instant Elevation, 90% of it is about getting your personal power back. If you're in your personal power, you can walk in, ask for what you need, and it is met. When we're not in our personal power, we've given it away to the authority, we've given it away to the system, we've given it away to the metal, we're a victim. And then it's like, you got to get this out of me, you got to help, nobody's listening to me. We don't have our personal power. And that experience is really, really challenging, because it's like, no matter what I do, no one's listening. No matter what I say, no one believes me. No matter what actions I take, they don't really pan out. That's an indication you've given away your personal power, and you could struggle and work your butt off your whole life long and not really get anywhere.
And when can a patient take on the FDA, take on the CDC, take on the WHO? Because that's what so many in my community are trying to do. And it's have a voice.
So that's
great,
an indication.
But we can't change that.
It's the same thing. Whenever I'm taking on, I'm not in my true power. When we're in our power, it works for us. It will have certain things take care of themselves. It will have a reliable, trustworthy practitioner come in who says, I can really take care of you. It will have the body come into harmony and no longer be reactive. So whenever we're in that energy of taking on, that's me using my small self power to like muster it up, because I have given away my true power.
And you did a remarkable little live Mindbody TV event yesterday and talked about embracing the hopelessness. We don't always have to power through, and we don't always have to show up. And I will say yesterday, I had surgery. I had an amputation of my tailbone a week ago. I laid on the couch. I did not want to anything yesterday. I had a podcast episode that was late, and I'm like, you know what? I don't want to. I want to curl up and watch a movie and lay under a blanket. And that's what I'm doing today. And it was okay. And I had to just know that I don't have to get up and I don't have to power through not feeling well. I can be here in this moment feeling like dog do and curl up under a blanket, and it's okay.
And there's the body's ability to heal itself. And when we're accessing our personal power, we amplify that so greatly. And that's what I've seen for people to resolve very severe medical conditions, autoimmune diseases, Hashimoto's, MS, ulcerative colitis, Crohn's, even cancer. Those inflammatory conditions or autoimmune conditions can resolve when we're no longer in that fight of, I've got to take care of myself, I've got to take it on. You can feel the heaviness of that, which may at first feel empowering, but it will ultimately be depleting, and it will always deplete your physical health. When we realize this is a whole consciousness of the whole, I'm being gaslit by the medical community, and I've had PTSD from my doctor, and like the whole conglomerate of that consciousness, which is a fear vibration, it's an inflammatory vibration. And so can I look at that and all the energies that go along with it with compassion, so it can begin to dissolve from my system, versus what I was doing, trying to heal myself, but I was just bringing it along with me. And I'm going to fight this. I'm going to fight the disease. But I was bringing all of those fear energies with me. And you literally will never heal when you do it like that.
Can you just tell us, and we're going to get into the specifics of how you do this in just a second, but you've alluded to some pretty big miracle stories. What's kind of like a couple of your big patient miracle stories, if you can share?
I had
healing from this work.
Well, if you heard of RSD, where people have a reflex sympathetic dystrophy, there's like a neurologic condition that increases the pain perception, and people could be in very, very severe excruciating pain for something like a really mild injury or a mild, like maybe they just barely bumped something, but it's propagated itself. And I've seen a lot of patients with severe pain syndromes, and that's kind of like one of the most severe that can happen. People often get put on narcotics, just finally nothing is working. It will get worse. And so I had a patient with RSD, reflex sympathetic dystrophy, where their nervous system gets sort of all geared up, and was on several medications, in and out of the hospital because of the pain, unable to walk. And we did this deep healing work to get back his personal power. Actually, like, he wasn't aware of how much power was outside of himself. And then it's conditional. I got to do this. I got to do that. I got to get it back. I got to fight. I got to advocate for myself, and really let him take his personal power back, which meant meeting some of the fears, moving through some of the traumas, not like in a therapy situation where you just like replay it. You're actually embracing the energies of it and allowing them to dissolve and release from your system, right? You're not holding them together and protecting from them anymore. And it was such a powerful shift within a really short time that the pain completely resolved. He got off narcotic pain medications. He was able to start biking again. But it was really a release of the fear and the shame that he had not known was there. Usually we protect ourselves from it. I don't have that. I don't have shame. This particular person was very successful and had overcome that and made lots of achievements, but the energy was still there in his body, just asking to be seen and asking to be met. And so we did some EFT tapping, and he was able to see, wow, I'm really scared this is going to get worse. I'm embarrassed. What will my friends think? Because he couldn't do his activities anymore. And so there was fear and shame. And he just made space for it, and it allowed it to release from the body. And then the physical body healed.
And you almost feel like if I look at it and if I acknowledge that it's there, then it really exists. So I can't look at it. I can't address it. I can't speak to it. I just have to power through. And
we think it's bigger than me. It's bigger than me. So if I stop suppressing it, it's going to devour me. It's going to destroy me. But that's the big fat lie that keeps us in the fight.
All right. So let's get into the meat of how we overcome that. Not only how do we stay positive through this journey, but what steps can we take to integrate the practices?
The first thing is the willingness to move toward something we've maybe done our whole life to avoid. It takes not only a great amount of courage, but we got to have a really good reason. Like, wait a minute, you're telling me I'm going to move into the fear, and I'm going to let go of my resistance, and I'm going to let go of the suppression. And this really hurt me. And so that first layer of like, I'm in danger, this is more powerful than me. If I stop suppressing this, I won't be able to do anything, right? Maybe I can't walk, but if I stop controlling this, I won't be able to do anything. So it's like that fear that letting go means I'm in danger. So that's kind of the first thing. If I stop proving to the doctor or taking on the system or advocating for myself or protecting, I'll be in even more serious danger.
And now a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with MelySA testing. MelySA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit MelySA.org to learn more and schedule your test. Trust us, you'll be glad you did. MelySA, a valuable diagnostic tool in medicine.
And so I would say we can do some EFT tapping if that is something you're open to, maybe for your audience, and move through some of these layers.
We can do some tapping. We can do whatever you would like to bring in for the community. That would be amazing.
So the second layer, and we'll do this with the tapping. So that's like the fear, right? I'll be in danger. I can't let go. The second one is the doubt. Like, there's no power in there. I've already tried everything. Letting go isn't going to create more. I've got to power my way through. And so with the second piece, it's like, okay, fine, I could let go and allow something higher, but that's not going to work, or I don't know how, or it's just another protective barrier. And then the third one of that real full surrender is it's hopeless. Like, I can't trust. It's not going to happen if I don't do it myself. I've got to take it on and I've got to power through. We haven't actually known what it's like to allow in a power that's bigger than what I already know myself to be. This is what happened for me when I was very sick. I understood everything about the body heals itself, but it was from like more an intellectual standpoint. I hadn't actually the experience of that level of power. And so that's kind of the third piece. In EFT tapping, if people are not familiar with it, it's a really, really powerful way of releasing energy and tension from the body. And so we're going to start with the outer edge of the hand, the pinky side of the hand. And you can do one side, you can tap them both together. It doesn't really matter. Just get some stimulation here. We're tapping on where the meridian channels course through the body to open up our energy centers and let the energy flow. And even if it feels really weird, I'm going to try it anyway if you truly are ready to let in some healing. And then you're going to do it with me.
Okay.
I'll walk you through the main points. So inner eyebrow point is here, and we start with that. Breathing in, breathing out. The main point, the main part is your breath. And then as we do the points, I'll talk you through, but first we'll just tap. So outer eyebrow point right on the bony ridge, underneath the eye, right on the top of the cheekbone, underneath the nose. And this may be really strange for a lot of people, but your body is filled with energy currents. So right here on the chin, and you're actually allowing a lot more energy to course through you when you tap these points. This one is a really powerful one, K27. So it's a kidney meridian point, helps a lot with discharging energy underneath the arm and then up on top of the head. And just breathe in and breathe out. You might feel really energized, even just that we're tapping these. You might feel absolutely nothing. You may actually feel a lot of the BS come up, like the belief systems of like, what the heck? This is weird. This is stupid. All that is your old protective mechanism of self-protection. I've got to take care of myself, but you're not letting in resources. So if you're ready and that's already been depleting and you realize like, this is really not working for me to like be on my own self-protection, you'll start to open to new resources, even if they seem a little weird. If you're not ready for that, breathe in and breathe out as we go. All right. So the first thing you're going to do, and you're going to repeat after me out loud, as you tap on the outer edge of the hand. So just say, there's no way I can let go.
There's no way I can let go.
There's too much danger.
There's too much danger.
And I need to protect myself.
And I need to protect myself.
Even though I can't let go.
Even though I can't let go.
I choose to soften my body anyway.
I choose to soften my body anyway.
Okay. Even though I'm in real danger here.
Even though I'm in real danger here.
The system is out to get me.
The system is out to get me.
I have to advocate for myself.
I have to advocate for myself.
I wonder what else might be possible.
I wonder what else might be possible.
Even though I have to prove.
Even though I have to prove.
I have to show them what's right here.
I have to show them what's right here.
And it's wasting a lot of my energy.
And it's wasting a lot of my energy.
I wonder if there may be a higher way.
I wonder if there may be a higher way.
Okay, inner eye, all this PTSD.
All this PTSD.
Outer eye, I have to prove to the doctor.
I have to prove to the doctor.
Under the eye. I have to prove to everybody.
I have to prove to everybody.
Under the nose, because no one can see me.
Because nobody can see me.
On the chin. I have to fight for myself.
I have to fight for myself.
Under the collarbone. All of the dangers around me.
All of the dangers around me.
Under the arm. If I stop fighting.
If I stop fighting.
They could destroy me.
They could destroy me.
Top of the head. All of these beliefs.
All of these beliefs.
All of these ideas.
All of these ideas.
Inner eye. That it's not safe.
That it's not safe.
Outer eye. That I'm in danger.
That I'm in danger.
Under the eye. And I have to keep fighting.
And I have to keep fighting.
Under the nose. Everything that's held this in place.
Everything that's held this in place.
On the chin. Known and unknown.
Known and unknown.
Under the collarbone. From my past.
From my past.
From what's happening right now.
From what's happening right now.
Under the arm. It's showing me.
It's showing me.
I have to keep fighting.
I have to keep fighting.
I have to take on the CDC.
I have to take on the CDC.
Top of the head. I wonder if there's a more powerful way.
I wonder if there's a more powerful way.
Take a deep breath. And let it go. And all you're going to do is feel your body. Just, was that weird? Was that true? Did it resonate? And you can just share for yourself, like any of that might have resonated, that came up for you as you tapped.
Oh boy. I think for me, it's just, this is just so heavy for me and for so many people. I just feel the weight for the community. It's just heavy. It's a lot. And
Perfect.
We often don't get to acknowledge how much it really is because we're just trying to hold it together. We don't have time for a breakdown.
That's right. All right. We're going to do a little more tapping. Inner eye, acknowledging this is really heavy.
This is really heavy.
This is keeping my body inflamed.
This is keeping my body inflamed.
Outer eye, all the programming.
All the programming.
That says I can't stop.
That says I can't stop.
Under the eye, all the programming.
All the programming.
That says this is the only way.
That says this is the only way.
Under the nose, I wonder if that's true.
I wonder if that's true.
That I really do have to keep fighting.
That I really do have to keep fighting.
On the chin, I wonder if that's true.
I wonder if that's true.
About what's going on.
About what's going on.
Under the collarbone, everything I think and believe about this.
Everything I think and believe about this.
All the pain I've experienced.
All the pain I've experienced.
I will welcome compassion for myself.
I will welcome compassion for myself.
For how hard this has been.
For how hard this has been.
How heavily this has weighed on me.
How heavily this has weighed on me.
Under the arm, how much I've asked of myself.
How much I've asked of myself.
Even though I'm exhausted.
Even though I'm exhausted.
And this kind of sucks.
And this kind of sucks.
Top of the head. I wonder if I could let something in higher.
I wonder if I could let something in higher.
Inner eye, something that's more powerful than what I have known.
Something that's more powerful than what I have known.
Outer eye, something more powerful than I could do on my own.
Something more powerful that I could do on my own.
Under the eye, I don't know how.
I don't know how.
I don't know how to let go.
I don't know how to let go.
To me, surrender means stopping.
To me, surrender means stopping.
Under the nose, surrender means letting them win.
Surrender means letting them win.
But what if it's not true?
But what if it's not true?
On the chin, what if my fight is just fueling both sides?
What if my fight is just fueling both sides?
Under the collarbone, what if I'm so powerful?
What if I'm so powerful?
But that's not how I actually need to use my power.
But that's actually not how I need to use my power.
What if I could open to a new way?
What if I could open to a new way?
That lets real power into me?
that lets real power into me.
Under the arm, then something could come through me.
Then something could come through me.
They would see it.
They would see it.
It would show up differently.
It would show up differently.
Top of the head. Instead of powerless victim fighting.
Instead of powerless victim fighting.
Inner eye. I could show up in power.
I could show up in power.
Outer eye. Soft and surrendered.
Soft and surrendered.
Under the eye. Even if there's fear here.
Even if there's fear here.
Present to my fear.
Present to my fear.
Under the nose. Letting more power come through me.
Letting more power come through me.
On the chin. That's what heals my body.
That's what heals my body.
Under the collarbone. That's what allows less inflammation in me.
That's what allows less inflammation in me.
And more strength.
And more strength.
No one can mess with me.
No one can mess with me.
When I'm in that surrendered strength.
When I'm in that surrendered strength.
I can meet the fear that's here.
I can meet the fear that's here.
The sadness.
The sadness.
Everything that's been part of this journey.
Everything that's been part of this journey.
And meet it with breath.
And meet it with breath.
Under the arm. And let something higher come through.
And let something higher come through.
And it can show me.
And it can show me.
And it can heal me.
And it can heal me.
Top of the head. And it can allow a major change in all of this.
And it can allow a major change in all of this.
Good. And breathe in. Take a big, big breath. Let your body relax. And then just feel what it's like to just let go. Let the body surrender. When the body's more surrendered, more exhaled, it's softer. There's more life force coursing through you. This is the essential first step.
And how many times do we go through, I catch myself doing this, holding our breath all day long, like not breathing. It's not just me. I'm sure it's all of us walk through life holding our breath all day.
So that's the second part of the instant elevation. The first part is getting your power back into your body. And the second part is how are you using it to circulate the energy here, that you keep your power, and your breath is a major essential part of that. If you're not breathing, so the outer is going to be a reflection of the inner, and the outer, like people rejecting me, closing doors, telling me you're wrong, you're full of crap, and prove it. That's all a reflection of me not being in my power and me holding my breath. So when we're in that, like, no, you don't understand. It's like, you might as well just let it go and just let the breath come through, because you're going to realize, oh, wait a minute, I could do 2% of the actions I'm doing, and they could have like 1,000% of the impact. When I'm
Talk more about the 2%. Yes.
Yeah. It's hard to let in a full breath when we're really scared because there's so much tension in the body. But if I just allow like 2% softening, I witness the fear. Sure, the fear is here, but I'm saying, all right, hi, fear. It's okay for you to be here. And I'm letting my body soften anyway. Now I'm 2% more open. But on a quantum level, that 2% opening lets in a massive amount of power. And you will see that.
And it's
shift.
Enough for change, right?
It will shift your brain functioning. It will shift your neurological functioning and your cellular messaging. It will shift your chemistry and the inflammation. So you decrease inflammation and cortisol. And it will really importantly shift how people perceive you. If you show up in the room, hey, look, here's what's going on. Here's what I've noticed. Let's look at this together. About your metal or about whatever, someone could receive you. Oh, tell me more. But if you show up in the room, I've had everybody wrong me and you don't understand and you need to take this metal out and let me tell you, and you're not really breathing that your body, they can't help you. All they can feel is your fight, and it will put them into fight. It's totally subconscious. Yeah.
So they can feel the energy field around you, and they may not even be conscious of it. They're just going to respond and react.
Yeah, it'll feel like an
unconsciously.
onslaught, like from the doctor's standpoint, because I've had this and I'm really energy sensitive. I've had patients come to me and they're in this stance of attack. And so your energy field as an individual on the other side, I was like, ah! And it will bury your like, oh, I'm not going to let this person in. Now, for me, being conscious of that, I could shift the dynamic and I could ask my patient, let's let this in instead of like fight. What do you really have to share? What are you really asking for? Let's look at this together. But until they get out of fight, we can't really create anything that could be a contribution to them. It's just not possible.
This is such a hard practice for some to kind of figure out. And for those who haven't delved into mind-body medicine or experienced it before, how do we tie this work best together up like in the next 5 minutes and give people a gateway to more?
The most important thing is compassion, because until you have compassion for how hard it's been to walk that journey, you can't ask yourself to surrender. You can't ask yourself to breathe more fully in the body. There's too much pain in the body. And so compassion is really the key to letting yourself get in your body. That's the only way you're going to have power. Breathe in your body. That's the only way people are going to feel you and you can have impact. You've got to begin to sort of clean up the pieces for all the pain and the challenges and the abandonment and the, fill in the blank that you've been through that's actually still here. It might have been 10 years ago and it's actually still here right now. And so presence, which is why in my process, the instant elevation, and we have a whole program around that. The first part of the 3 steps is all about presence. How am I showing up in the moment? How am I noticing my fear, my pain? Am I in a battle with it? Or am I in receptivity to it? If you're not in receptivity to yourself, I promise you're going to keep finding doctors that can't receive you.
And I think really a key thing, at least for me, is that you got to feel it to heal it. Feeling it is not bad. Feeling the pain, feeling the sadness, feeling the abandonment, letting yourself cry, expressing yourself and how hard it's been is really the very thing you need. It's not the thing you need to push off.
Yes. And it's really beautiful when you do, because that's when the healing happens.
So tell us a little more about some of your programs and how people who want to engage more with you and your content can find you, how they can show up. You have a lot of free content. You have some wonderful paid content and wonderful bundles. Tell us all the things.
So we basically have online courses that guide you through step by step this work in your own body. You're really your best doctor. And you've got to show up in that space for yourself to help your body release the trauma and release the fear and release the doubt and all these things that are holding you back. And it will. I mean, that your body knows how to heal itself. And so I think the first one I'll start with is the book, because this is an awesome toolkit. The Mindbody toolkit is available on Amazon or on my website, drkimd.com. And it's 10 tools you can use anytime, anywhere to immediately let the body open for healing. The healing happens in the moment. It's not 10 years later. It's right here, right now, but you've got to let it in. And so this is a new way to call your power back, a new way to breathe your body, a new way to let the emotions release instead of holding them in. You can also get it on my website at drkimd.com/book. And it comes with some videos and guided tools to walk you through the material in the book. The Instant Elevation program, which is where we do that 3-step process, it's kind of the foundation for all of my work, is also available on the website, drkimd.com/IEP. I do a weekly live broadcast for those who are new to this work and you're like, maybe this makes sense. Let me delve a little more into this and receive more. Every Wednesday live at 11 a.m. Mountain Time, we broadcast Mindbody TV on my YouTube station, Dr. Kim Duramo, and in Facebook in the Mindbody community, where you can speak to our coaches, ask questions, connect with the community, and get a little bit more sense of what this work is.
That is awesome. I hope you don't mind, but I'm actually going to purchase one of your books and give it away to one of my listeners. If you guys will comment or like or share, I'm going to make sure that one of you guys gets one of Dr. Kim's Mindbody Toolkit books. It's going to be amazing. I have it. I honestly have not read all the way through it yet. I'm so bad, but it all comes when it's supposed to, doesn't it?
Yeah, well, you can practice just one tool in there and just for life, let that keep opening you. So the work is very powerful.
These tools are so valuable that even if you can just do a 2% trial of anything that Dr. Kim, any technique, it has been such a blessing to me. And I've seen you bless the lives of so many others. And I'm so grateful that you took the time to come talk to my metalhead community today. Is there anything you want to say in wrapping up?
I would just say, go slow with yourself, be gentle, because there's sometimes when there's a lot of pain, you just have to be gentle. That gentleness is the medicine, and it will allow your body to start opening and receive a whole different level of resources than what you've maybe ever encountered before.
I appreciate that. Now, I'm going to depart just for a minute because you can't come on the Heavily Metal podcast without talking about your favorite heavy metal band and your favorite heavy metal song. We are totally doing a 360 here.
I really love the song Back in Black by AC/DC because when I was in college, we did a number to that. And I hadn't been into that kind of music before, but it was kind of badass and kind of like really raw. And I accessed a deeper part of myself. And I've always loved that song ever since.
Do you have a favorite heavy metal band?
I guess that would be the one, that AC/DC is pretty rad. So it's not my genre in general, but that's opened something for me.
Now, you did start singing. I've seen that. Are you still singing? You sang with the band for a little while. Is that still a thing for you?
I have still been singing with the band. We do more like some rock. We do some folk and some bluegrass and stuff like that.
Well, the heavy metal stuff is all classic rock now because we are old. All right. Well, thank you for being here. And I always end with telling the medical community that we're not going to take it anymore. But how about we put a Dr. Kim D slant on this time and tell ourselves that we're not going to take it anymore. That old way of doing things is hitting the road, Jack.
Amen. Thank you.
Thank you. Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetal.com where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.